Hello, my name is Raina Barakat, and today we're going to be talking about improving multicultural prenatal care in South Carolina. One of the major concerns that South Carolina undergoes is the high disparity rate of infant and maternal mortality. Race and ethnicity are publicly generated approaches for grouping people that are related in many types of inequalities. Inequalities in health and healthcare services are often described as racial and ethnic disparities of health. As of 2007, South Carolina's infant mortality rate was 8.5 deaths for every 1,000 live births, and race-specific infant mortality rates of white infants was 6.2 deaths for every 1,000 live births, and 12.9 deaths for every 1,000 live births for races other than white. The overall infant mortality rate was twice more likely for minorities than of whites. Birth weight is the most important sign and increased threat of deaths in infants and future chronic disabilities. Most of the local women of South Carolina that didn't receive prenatal care needed to ensure a healthy pregnancy shared these same characteristics. They were less educated, came from a lower socioeconomic status, less than the age of 25, unmarried, on Medicare, and didn't have the transportation necessary to reach these facilities. The major issue at hand here is to expand Medicare coverage and help those in need. Women of color in South Carolina fare profoundly worse than whites in every trait of reproductive health. The maternal mortality is incredibly high because of the astonishing high rates of mortality among colored women. African American women are almost 4 times probable to die in childbirth than white women. This disparity is largely accredited to the fact that women of color, particularly those of low economic status, incomparably lack the access to prenatal care that is crucial for health birth outcome. Women of color also repeatedly obtain fewer services and inadequate health promotion education throughout their prenatal care visits. Women of color experience many obstacles in order to gain the proper prenatal care, such as not enough funds, no insurance, not being able to get an appointment with a provider, with the cost of the normal pregnancy and hospital birth averaging to $7,600, the lack of insurance is perhaps the most significant preventative quality of pregnancy care for low-income women of color. Government policies have worsened rather than making these barriers better. Access to prenatal care refers to how pregnant women can obtain health care when needed. All of these measures show how racial and ethnic disparities in healthcare access and quality in South Carolina. Access to care is important because it is related to receiving appropriate care in a timely manner. The recommendations of action are as follows. To further the ethnic and racial minority populations in South Carolina by suggesting the attention and importance of culture and language in the healthcare setting to improve the quality for the maternal and infant populations. To increase the proportion of unrepresented South Carolina racial and ethnic minorities among healthcare professionals. Back in the late 1970s, doctors that were performing Medicare deliveries failed to deliver babies of black women unless they first contracted to be sterilized after delivery. Current government policies have additional brought about the disparities in health care access for several racial and ethnic minorities, namely in healthcare coverage. Studies have shown that women with health insurance, regardless of age, income, education, or socioeconomic status, have better access to the health care system and are more probable to receive care when needed. However, federal policies such as the Personal Responsibilities and Work Opportunity Reconciliation Act of 1996, Welfare Act Reform, and the Deficit Reduction Act of 2005 have reconstructively influenced the health insurance status of many in our most susceptible populations, particularly low-income people of color. These policies have changed eligibility requirements, admission procedures, and cost-sharing limits for countries, primary health care coverage safety net programs, such as Medicare and state children's health insurance program. The population growth has been increasingly rapidly racial and ethnic minorities and language minority residents in South Carolina. These demographics adjustments are in demand and that the health professionals maintain regularity in instructing future and current South Carolina health care providers to handle diversity in the practice. As one of the most developed countries, America should be able to provide quality prenatal care to help every mother. South Carolina ranks as 46th in the United States for infant mortality. South Carolina must work to increase the racial and ethnic diversity of healthcare in the healthcare workforce. South Carolina patients of color are more likely to be satisfied with the care provided by the diverse group of professionals and exhibit the racial and ethnic minority healthcare providers are more likely to work in minority and medical underserved communities. Additionally, more diverse and upper levels of hospital administrations can have constructive impact on the care provided, including more ethnically and linguistically proper services. Thank you for listening. I hope you enjoyed this message.